way. Allergies, asthma, sinus problems. Same thing. Those things can, what I just talked about, can help with all those things. All right, you are the answer to your health and your health problems. You are. You are your best investment. Great health doesn't come, it doesn't exist in quick, easy, and convenient. But you are the answer to these things. We were talking about last week a variety of different things and the health and the medical approach and the holistic approach to different signs and symptoms or health problems. And so we're talking about, say, for neck pain, the medical approach versus the holistic approach. What would I do? How about things like headaches? How would someone in the medical world approach headaches? Typically it would be either over-the-counter drugs or prescription drugs or Botox injections, even as severe as cutting nerves that go to a certain area, or tell you to reduce stress, or put you on antidepressants, Xanax, Zoloft, Paxil, Lexapro, things of that nature. They won't address the causes, they'll just address the symptoms. That's the difference between medical and holistic. One addresses signs and symptoms with drugs, surgeries, and something of that nature. Holistic looks to see if there's a natural approach, to find the causes of it and address the causes. And we look at the body as a whole. So for headaches, what's one of the common things? Adjustments. Why? Because there's a lot of headaches that are associated with musculoskeletal problems, tension headaches. So if someone has had trauma, car accidents, falls, misalignments from those things, or just general activities of daily living, sleeping on the sofa wrong, when you were younger playing sports, or even older playing sports, falling down steps, roller coasters, if you're as little boys, you're putting each other in headlocks and giving each other noogies and dragging each other around by the neck. I mean, if you look at what we've done from the minute we're born until now and all the physical stresses that have been placed upon us, well, that can affect the neck and the alignment and stress to the joints. As you may have heard me talk about, what typically happens is you have the spine. The spine, again, is your lifeline, but the spine surrounds and protects the nervous system. You have your brain and spinal cord that make up the central nervous system. The skull protects the brain. The tube of bones protects the spinal cord. You have this structure that now the shoulders attach into it, the hips attach into it. So the skeleton, right, the spine, again, the spine and pelvis is central to everything. It not only encases the nervous system, but everything attaches into it. So if you have problems in a spine, it's going to potentially affect everything around it or that's attached to it. So you have misalignments of the spine gets stuck, the joints don't move right anymore, it affects mobility. That mobility can lead to micro tears of the cartilage, so over time it results in arthritis. Muscle changes will happen, so muscles are supposed to be symmetrical, but because of the misalignments or because of the joints that are now not moving right, muscles can react and become tighter or actually too loose. So you'll get hypertonicity or hypotonicity, but they won't be symmetrical or even. There's supposed to be a tone to muscles, a natural tone, a natural tension that's normal, that keeps things stabilized. You can lose that natural tension, and so it becomes either increased or decreased. That affects the joints and the skeleton. It affects motion, mobility, but then remember those muscles have tendons that anchor into the bone. And if those muscles are abnormal, too much tension on one, say, it can cause or predispose that tendon to have tendon problems, tendinitises, tendon tears, and that can predispose you to a muscle tendon problem, a tendinopathy, a tendinitis, things of that nature. But no one will address the skeletal end of it unless you go to a chiropractor per se. That addresses the skeletal end of it to help those things heal, plus the neurological supply to it. You have misalignments, it can affect or stress out the nervous system. So it's like a dimmer switch. It is said that the weight of a dime on a nerve root can decrease its function by 50% within a few minutes. 5 millimeters of mercury pressure on a nerve root can affect nerve transmission, the communication of the nerve. So people walk around with these all day. They walk around with this stress and tension in the nervous system all day. That's affecting their mobility. That's affecting their nerves. That's affecting their muscles, tendons. The ligaments get sprained and they don't have support. So the adjustment restores all that, or seeks to restore all that, or improve function to the best of the ability and all that. And one of the things with headaches is when you have neck problems, you have those neck issues or joint problems that we just talked about, or muscular reactions or whatever. There's different types of headaches, but by adjusting the neck, adjusting the spine, it can potentially, and in so many cases, just take the stress off the nervous system, out of the muscles, and then those headaches can either subside or totally go away. Less toxicity in your body. Why? Because you're not taking last week we talked about things like drugs, the side effects of drugs. What does aspirin deplete you of? Folic acid, iron, potassium, sodium, vitamin C. Ibuprofen, folic acid, acetaminophen, depletes you of glutathione. All these things, sometimes if you're on prednisone or cortisone, depletes you of calcium, folic acid, magnesium, potassium, selenium, vitamin C, vitamin D, and zinc. And of course, what do we need right now because of our immune systems and having to fight viruses? Zinc, vitamin D, and vitamin C, very powerful to support your immune system. And if you're taking drugs to suppress that or deplete you of that, that's not good. So, natural ways to deal with headaches. Chiropractic adjustments, either in the neck or the upper back region. CBD oil is another way. Essential oils, peppermint. You have a headache? Put some peppermint oil, provided it's therapeutic, on your temples. A lot of cases it helps minimize, or in some cases helps it go away. Frankincense at the roof of your mouth does really great with migraines. How about diet? Food allergies, food sensitivities. They play a role in headaches too. Those are the natural holistic ways of dealing things, as opposed to being put on toxic drugs or just treating symptoms and people are suffering. I often tell of a story of a 21-year-old girl who came into the office who was struggling with migraine headaches for years. And she said her college experience was robbed from her because of her migraine headaches. And through chiropractic and changing diet, her migraines went away and she was able to get off of drugs. I hear those stories all the time in practice. You know someone who's struggling for headaches, with headaches, migraines? Tell them to call the office. CalabroChiropractic.com, 609-653-9501. Who knows? Can't promise anything, but history has shown that we can help those naturally.